My name is Chloe and I'm Senior Engagement Officer for Healthwatch Cumberland. So Healthwatch Cumberland is an organisation that is representative of the people who are in the communities that we live in. They're all over the UK, but I work for Healthwatch Cumberland and I get to hear about the views and the feelings of people who are based here. So it's your local champion for your local services across the whole health and social care sector, and our hope is to make services the best they can be. And what that means is we have to listen to people and advocate for people, so we kind of fill the gap between the system and the people of the public. It's a real privileged place to be. Get to hear from the most vulnerable people in society and get to represent their thoughts and feelings, whilst right through to people who just need a little bit of additional support. It might be that they need signposted to certain services. We aren't the experts in all things, but I can tell you who is an expert in that field potentially, and we can do a little bit of a look around for people. A big part of what we do is research projects, so that might look like taking a particular topic of something that we've heard through the grapevine that's been filtered down from Healthwatch England, and with that we'll run a project specific to that need. So we'll hear about what's going on, and then from there we'll be able to kind of get ourselves kind of invested in those spaces and really hear what the reality is, good and bad. We hear a whole range of thoughts and feelings. We want to hear great stuff so we can share best practice, but we really want to know where the areas of concern are so we can improve the quality of the service that's being delivered. So earlier this year we got the opportunity to complete a project called Disability Voices, and what that entailed was us as engagement officers spending time with people living with disabilities and trying to find out what it was like to live in Cumbria with a disability and what the challenges are and what the barriers are to living like a full quality life. Equally, we heard lots of good practice and lots of really positive things, and that was really good and it was reassuring and reaffirming, but what it also raised was how much we've still got a long way to go. And one of the great opportunities we had was when we got to make these recommendations based on what we found from these projects that we were completing, and we were going to all these different services and speaking to all these different people, that we were able to make recommendations based on what people were telling us. And then that is our equivalent of advocating for the minority. So we're able to go in and share what we've heard about this particular service and how we feel that they would benefit from making these changes, and how it'd be more accessible and more inclusive should they make those changes. I guess we have a responsibility to do that. You know, like it's all our responsibility to include people, and we've got to make room at every table for every type of person from all different backgrounds, and it's just what makes the world go around, isn't it? So when people aren't in a position to be able to advocate for themselves, we have got to fill in the gap. And that isn't just in an advocacy awareness week, it's every day. It's an everyday responsibility and everyday privilege. You know, it's a real honour to be able to speak into those spaces and those lives of people.